Hi, I'm Anu, a critical care resource nurse. In this video, we'll go through how to care for a tracheostomy. It's important to follow standard practices to help ensure that the tracheostomy or trach tube remains unclogged and does not get dislodged during care. Start by washing your hands. Clean hands are the best way to prevent spreading germs. Gloves are optional. Gather the necessary supplies. These include a stable work surface near the patient, surface suction device or little sucker, tracheal suction catheter, normal saline bullets, new tracheostomy Velcro ties, blunt tip scissors for trimming trach ties, cotton tip swabs, 4x4 gauze or a washcloth, 4x4 split gauze, depending on adult neck size, and a speaking valve device if applicable. You are now ready to perform suctioning, trach tie change, and trach stoma cleaning. Whenever you perform care to the trach tube, it's important to make sure the patient is breathing comfortably. If the patient is performing care by themselves, a mirror is necessary. If suctioning is needed, do this first. Surface suction is performed with a small suction device like the little sucker. The surface catheter is used to catch the secretions the patient coughs up. Place it at the side of the opening to the trach tube. You will need to apply the suction to the trach tube while coughing up secretions. If there is wet-sounding breathing or additional suctioning is needed, use the tracheal suction catheter to remove deeper secretions. Tracheal suction is performed with a thin, flexible catheter that goes into the trach tube and can enter the windpipe, also known as the trachea. Before you begin, make sure you know how to deep suction. It's important that you do not suction beyond the length of the tracheostomy tube. Suctioning too deep can irritate the trachea, leading to pain or bleeding. The length of trach tubes can vary, so you will be trained on how to assess the trach tube's length and how to deep suction. For this demonstration, we will insert the suction catheter to 2 inches. Insert the suction catheter without applying suction. When you have reached the proper depth, apply suction, twist, and remove. Hold the suction the entire time you are removing the catheter. To prevent airway blockage, make sure that you do not keep your suction catheter inside the trach tube for longer than 10 seconds. If you have trouble passing the suction catheter, there may be a thick mucus plug in the trach tube. If this is the case, sterile saline provided by your home care company may be used to break up the mucus. After applying the saline, try again to pass the suction catheter. Thick plugs may require repeating this process, so always check for comfortable breathing. If breathing becomes difficult and you have a self-inflating bag, give a few breaths. If this doesn't help, or if a self-inflating bag is not available, then change the inner cannula immediately. Replace trach ties once every day or when they are soiled or wet. Start by washing your hands. If needed, you can trim the Velcro tabs at an angle to make them easier to pass through the trach tube wing holes. To get a clear view of the neck and tracheostomy site, place a rolled up towel behind the shoulders, or if able, sit up and lean slightly forward. Remember to always keep one hand on the trach tube to make sure that the tube does not become dislodged. If you are doing this yourself, make sure to have someone with you or nearby to help. Avoid covering the trach tube opening for easier breathing. Depending on neck size, you may need to adjust the Velcro strap. These Velcro ties can be washed with soap and water and reused once dry. While stabilizing the trach wings, release one of the Velcro ties and slide it out of the wing hole. Slide the new Velcro tie into the same wing hole and secure. While continuing to stabilize the trach tube, secure the Velcro to the end of the new tie and pull it behind the neck. The new tie will follow. Remove the old Velcro tie from the second wing hole. Then place the new tie through it, securing the Velcro. Check each side for fit. You should only be able to place 2 fingertips between the skin and the tie on each side. To clean the stoma site, place a rolled up towel behind the shoulder to get a clear view of the neck and tracheostomy site, or if able, sit upright. If there is a humidifier, trach collar, or other device, it's okay to remove this during trach care. If using a ventilator, do not disconnect the tubing. The first step is to remove the old split gauze while stabilizing the trach tube. Look for any drainage, like blood or pus on the gauze. And call your provider if you have concerns. Observe the skin around the stoma. Look for sores, redness, or granulation tissue. Granulation tissue is overgrown, fragile tissue that bleeds easily. If you have any concerns about how the stoma looks, let your provider know. Use a cotton-tipped applicator wet with saline to clean the stoma site beneath the wings on each side and around the stoma. Always keep one hand on the trach tube to hold it in position while you're cleaning the surrounding skin, and avoid covering the trach tube opening. If you see any drainage or oozing from the stoma, replace the split gauze to wick moisture away to prevent damage to the skin. Use a cotton tip applicator to help insert the split gauze while stabilizing the trach tube with the opposite hand. Make sure breathing is comfortable during the cleaning and after you are finished. Some people can use a speaking valve attached to their tracheostomy tube. This is a one-way valve that allows patients to communicate more clearly with their trach tube. The speaking valve also helps people cough and clear secretions more effectively while improving muscle strength for breathing and swallowing. The most common speaking valve is a passing mirror speaking valve, or the PMV 2000. Before applying the speaking valve, be sure to wash your hands thoroughly with soap and water. Check to make sure that the tube is either cuffed or cuffless. If the tube is cuffed, you will need to attach a 5 or 10 cc Luer lock syringe to deflate the cuff fully before placing the speaking valve. Once the cuff is deflated, you can attach the speaking valve to the trach tube by holding it in one hand between your thumb and forefinger and placing your other hand gently on the faceplate of the tracheostomy, using a quarter turn clockwise to secure the valve. You will need to add a little pressure during the attachment to make sure it fits securely onto the tube. Once in place, take a breath and start speaking. The valve is open during inhalation and closed during exhalation. It may take some time to get used to using this device. You may benefit from cues to actively utilize the upper airway while using this device by inhaling through the nose and exhaling through the mouth. In the beginning, you'll be closely observed by your care team to see how well you tolerate this device. The speaking valve should be removed if there is any shortness of breath or intolerance to the device, and alert your care team.